and a very warm welcome to all our esteemed speakers, partners, and delegates joining us today on a Sunday morning. It is truly encouraging to see such a diverse and committed group of stakeholders in this room, where we have truly a diverse group of stakeholders, which is clinicians, emergency care specialists, and rehabilitation experts, hospital leaders, administrators, and policymakers, along with researchers, innovators, and patient advocates, all coming together with a shared purpose that this diversity is exactly what makes today's platform so meaningful. On behalf of Voice of Healthcare, I'm delighted to welcome you all to the Voice of Healthcare's third edition of National Stroke Conclave and Awards, endorsed by Indian Stroke Association. And today's theme is innovation, partnership, and policy, which reflects the direction we need to move in to strengthen stroke care in India together. And if we look at stroke care in India today, I believe we all would know about this, that the scale itself highlights the urgency of this conversation, which is with nearly 2 million new cases every year. Stroke continues to be one of the leading causes of death and a long-term disability in our country. But what makes this challenge even more complex is that less than 15% of patients reach to hospital within the golden window. The critical time where timely intervention can significantly improve the outcomes, which means the challenge is not just clinical. It is about how effectively our systems are able to connect and deliver the care, where every minute matters in stroke. And that is exactly why we are here today, towards collaboration and coordinated action to bring together the clinical expertise, policy direction, innovation, and public health system and look at stroke care, not in parts, but in complete, connected, and continuum. From early recognition and emergency response to hospital readiness and rehabilitation, every step plays a very crucial role. And improving outcomes will depend upon how we align these efforts and work together in a shared direction rather than working in silos. So let me just take this moment to acknowledge the force behind this initiative, why we are here, why we are going to discuss this important issue, is Voice of Healthcare. Voice of Healthcare is a national healthcare media platform focused on bringing together impactful ideas, leadership voices, and innovations that are shaping India's entire healthcare ecosystem. By connecting clinicians, policymakers, industry leaders, and innovators, VOH creates a platform where meaningful conversations can translate into real-world impact. And let me tell you, this journey was not easy. We have built by every step, every event, every conference, and every public health awareness. So I would just like to take you through Voice of Healthcare's journey and how we have reached to today's conference. May I have your attention over this video? Can I have a video, please?
Healthcare never sleeps, but too many voices go unheard. Brilliant ideas are being created, but the right people aren't always hearing them. Voice of Healthcare exists to bridge that gap between medicine, media, and the people who matter. We're not just an event company, not just a media house. We are a healthcare communication engine. We serve every stakeholder of healthcare, not with one message, but with the right message for each. Voice of Healthcare operates across multiple verticals, from live forums and strategic dialogues to powerful media, global collaborations, and high-impact health content.
तो ऐसे मंचों से वो अनुभूति बनी रहती है और इंसान अपने जीवन में और एफर्ट्स करता है और कुछ अच्छा करने का प्रयास भी करता है.
It's a great honor and I'm extremely glad I could be present here and be part of this wonderful event.
From the time that we're born to the time that we die, I think our lives are incomplete without the doctors, the nurses.
So that dental care has to be brought in as part of the regular package as such.
That as the attendant costs of healthcare go up, the public cannot keep up with it by paying the premiums.
I'm very grateful to the second edition of IVF Summit for inviting me for this.
And I also thank VOH for inviting me and this wonderful evening, and I hope that next time more there will be some participation from government side also.
The leading manufacturing hub for medical devices globally, and move over from being 70% import dependent.
Our numbers speak. Our reach multiplies. And with every voice added, the impact grows stronger. The future of healthcare will not just be built, it will be heard. Voice of Healthcare, where healthcare finds its voice.
Thank you, and thank you for being part of our journey also. As we come back to today's conference, it brings us to the core of why we all are here today. Because when it comes to stroke care in India, the challenge is not clinical, it is systematic. From early recognition and emergency response to hospital readiness and rehabilitation. The addressing gaps are there, and we need expertise to address those. But collaboration across stakeholders help us to move ahead. So we would just like to take a moment to acknowledge and thank our partners whose support has been instrumental in making this platform possible. We are supported by Quality and Accreditation Institute and the India Hypertension Control Initiative, and endorsed by the Indian Stroke Association. We would like to thank our title partner, Yatharth Super Speciality Hospital, our academic partner, Parul University, and our associate partners, Neuro Equilibrium, and Healthcare at Home Rehab and Recovery Hospital. We sincerely thank all our partners for enabling such conversations and supporting initiatives that aim to strengthen stroke care in India. The Voice of Healthcare's National Stroke Conclave has been designed to address the gaps across the entire stroke continuum. And today's focus is not just on discussion, but on identifying solutions that can be implemented and scaled across different healthcare settings, from urban hospitals to district and rural health systems. And now, to formally begin today's proceeding, it is time to mark this occasion with a ceremonial lighting of the lamp, the tradition that symbolizes knowledge, hope, and new beginnings. May I request our esteemed dignitaries to kindly join us on stage for the lamp lighting ceremony. I would like to invite Dr. Nishchal Naveen, Dr. P. Ganesh Kumar, Dr. Rajendra Dhamija, Dr. Arvind Sharma, Dr. Kunal Behrani, Dr. Amit Singh, Dr. Prashant Mathur, Dr. Shailesh B. Gaikwad, Dr. Kameshwar Prasad, Dr. Tina Raval, Mr. Neeraj Lal, and Dr. Anita Bhandari.
शत्रुबुद्धिविनाशाय दीप
Thank you, sir. Thank you so much. Segments of today's conclave. Our inaugural session. This session sets the tone for the day, bringing together leadership voices from clinical practice, global stroke advocacy, to public health system and policy. Together, they will help us understand not just the challenges, but also the direction forward for stroke care in India. I would like to call upon speakers Dr. Nishil Naveen, founder, Voice of Healthcare and a serial entrepreneur. Dr. Vikram Huded, President, Indian Stroke Association, Director, Interventional Neurology at Narayana Health, leading India's Save the Brain movement. Sir wanted to join us, but due to some urgent family emergency, he couldn't join us. But we do have his message with us. Dr. Arvind Sharma, Secretary, Indian Stroke Association, Head, Department of Neurology, Stroke Specialist and Neurosonology at Zydus Hospital, Ahmedabad. Member Board of Director, World Stroke Organization, President, Society of Neurosonology. Dr. Jairaj Pandian, President, World Stroke Organization and Professor and Head of Neurology, Principal and Dean at Christian Medical College, Ludhiana. Due to last minute of work, Sir couldn't join us, but he will be there with us virtually. I would like to call Mr. Amit Singh, Group CEO, Yatharth Group of Hospitals. Dr. Rajendra K. Dhamija, Professor of Neurology and Director, Institute of Human Behavior, New Delhi, India. Chair, National Task Force on Brain Health, Niti Aayog, Government of India. And Dr. Prashant Mathur, Director, Indian Council of Medical Research at National Institute of NCD Epidemiology. Thank you so much, sir. Thank you so much for joining us here today. And to begin this session, it is my privilege to invite someone whose vision has been instrumental in bringing platform like this to life. A healthcare entrepreneur who has consistently worked towards creating a meaningful dialogue and collaboration across the industry. I would like to call upon Dr. Nishil Naveen, founder, Voice of Healthcare, for his opening remarks. Thank you so much, sir.
Thank you very much, Simran. Respected dignitaries on the stage, Dr. Arvind Sharma, Mr. Amit Singh, Dr. Rajendra Dhamija, Dr. Prashant Mathur, dignitaries of the stage, Dr. P. Ganesh Kumar, Neeraj Lal, Dr. K. Madan Gopal, Dr. Tina Rawal, Dr. Shailesh B. Gaikwad, Dr. Kameshwar Prasad, Dr. P. Vijay, all stroke care providers, policymakers, industry colleagues, and our audience watching us live on various social media channels. A very warm welcome for National Stroke Conclave 2026 on behalf of Voice of Healthcare. On this third edition, once again, we are bringing all stakeholders of stroke care onto one platform. Be it clinicians, innovators, policymakers, quality stalwarts, everyone who's working in stroke care is here in this room. As a doctor, when I look back, and during this journey, I have seen that myocardial infarction, which is heart attack, and stroke, which is brain attack, both are cardiovascular problems. But every time, MI steals the spotlight, and nobody cares about stroke as much as we should care about it. Every year in India, we witness 2 million cases and around more than 1 million deaths. Although stroke is a sudden incident, but it is not like that it happens. I mean, its journey begins even before that. And we can have a lot of opportunities to stop one incident of stroke, right from whether it is, promotion of health or treatment of hypertension or, timely treatment of stroke or, even post-stroke care to reduce morbidity. So we have a lot of opportunities to take care of this problem during this care continuum. But somehow we are lagging behind. I remember that during my practice days, when I was practicing as a physician, I'm a medical specialist. Post my MD medicine, I practiced almost for 10 years. And I saw that nobody cared about hypertension. Everybody used to think कि ये कोई प्रॉब्लम तो कर नहीं रहा है, मुझे हाइपरटेंशन, कुछ प्रॉब्लम तो हो नहीं रही है, मैं दवाई क्यों खाऊं? And this issue is not it's not like that people don't know about this problem, but this is I would say that this is a socio-cultural issue. This is Indian mindset कि मुझे कुछ नहीं होगा, मैं तो ऐसे ही ठीक रहूँगा, मुझे कोई बीमारी नहीं है, मुझे दवाई की आदत नहीं लगानी है. And whatever you teach them, whatever you tell them, they won't understand. And I would say that this is a socio-cultural issue which we have to address to prevent stroke in this country. While talking about stroke care in India, as you know that India is a very large country, we don't have enough neurologists to take care of this country. Even if we have neurologists, mostly concentrated in metro cities. There are more than 800 district towns in India and 3,000 tier 3 towns. And when we don't have enough, physician, I can't talk about that we have enough neurologists to take care of this size of population. But at the same time, awareness and technology, latest innovation, telestroke, teleconsultation, we can bridge the gap. When I look back at my entrepreneurship journey, when I was running hospitals, I created hospitals in tier 2, tier 3 towns. And I made sure that every hospital has one CT scan. I set up 150, 200 bedded hospital in tier 2, tier 3 cities so that I can take care of patients of stroke, heart attack, neurotrauma, ICU care. Do we have these kind of hospitals in all district towns of India? No, we don't have that much infra in these towns. But at the same time, with technology, we can bridge the gap. Today, we will discuss all the aspects of care continuum of stroke. While we are mobilizing voices from all the sectors for this cause, I truly believe that we can together create an impact in stroke prevention and stroke care. To conclude, today we have some fantastic speakers in this room, and we will deliberate all pertinent issues around stroke continuum. And I request and urge all of you to, listen to them, take note of them, that what they are talking, and simultaneously try to network with people sitting beside you, because we learn from each other. With that, I again welcome you all to this third edition of National Stroke Conclave 2026. With that, thank you very much. Thanks a lot.
Thank you, sir. Thank you so much for that opening address. We now move on to our first keynote address, which is, I would like to have a message of Dr. Vikram Huded. Sir couldn't join us because of a family emergency, but we do have his message. Can I have the message on screen, please?
Respected dignitaries, colleagues and friends, good morning. I thank VOH for organizing such a wonderful meeting. Today I want to draw your attention to a silent epidemic, brain stroke. We often think of war happening outside our borders, but a real war is happening within our country. Every day, thousands of Indians either lose their lives or live with permanent disability due to stroke. And the most important fact is, stroke is preventable, stroke is treatable. According to World Stroke Organization, 1 in 4 people will suffer a stroke in their lifetime. Data from Indian registry shows nearly 1 in 7 stroke patients in India is under 45 years of age. Only 20% reach the hospital within the golden window of 4.5 hours. Less than 5% receive thrombolysis. Less than 1% receive thrombectomy. This is not because treatment is unavailable. This is because systems are not optimized for speed. In stroke care, we say time is brain. Every minute of delay leads to loss of nearly 2 million brain cells. Recently, during an IPL match, a cricketer suffered a serious head injury. A green corridor was immediately created, ensuring rapid transport to hospital. That system worked. The speed saved brain function. Why should this level of urgency be reserved only for isolated incidents? Why not for every Indian citizen with stroke or head injury? Such system we create. On behalf of Indian Stroke Association, we propose 4 key national priorities. One nation, one emergency number is already there, 112. In this system, when a patient calls, the system should identify stroke symptoms and activate a stroke pathway. Second is GPS-enabled ambulance routing. Ambulances must triage intelligently and transport patients to the nearest stroke-ready hospital. Third is national mapping of stroke centers. Only certified stroke centers should be mapped and integrated with emergency system. Fourth is green corridors for stroke and trauma. This should be extended beyond organ transplant to include stroke and head injury. The brain cannot be transplanted. We must save it in time. Save the Brain, a national movement initiated by Indian Stroke Association. Brain stroke is preventable and treatable. We are working on public awareness to make them aware of BFAST symptom. We are training physicians, risk factor screening, especially hypertension, and inclusion of brain health in routine checkups. Like high-risk patients, they can do carotid Doppler, which is a simple test. And if there is a family history of brain aneurysms or brain hemorrhage, they can do MRI scan, which is without contrast and radiation, and we can prevent brain stroke. Next year marks 100 years of cerebral angiogram by Igaz, an eminent neurologist. This is an opportunity to strengthen stroke systems and awareness nationwide. What we need from policymakers: integrate brain stroke into 112 emergency response, enable GPS-based ambulance routing, fast-track stroke center certification, support green corridors for neurological emergency, drive mass awareness campaign that brain stroke is preventable and also treatable. In stroke, we cannot get a second chance. A delayed ambulance or wrong referral can mean lifelong disability or death. With the right system, we can save brain, we can save lives, we can save families. India has the expertise, India has the infrastructure. Now India needs system integration. No brain should be lost due to delay. Thank you.
Also like to convey our regards to Dr. Hudaid for those valuable insights and for his continued efforts in strengthening stroke awareness and care in the country. Now, I would like to invite Dr. Arvind Sharma, our next speaker, which brings with him with deep expertise in neurology and stroke care, along with strong contribution at both national and global platform. So, can we please have your special address?
Thank you. I thank dignitaries on the dais, Dr. Nishal, who's the force behind this, Mr. Amit, Dr. Tameja, Dr. Mathur, and dignitaries of the dais, our teacher, Dr. Kameshwar Prasad, Mr. Neeraj Lal, Dr. Ganesh, and Kunal, who has taken this initiative this year for this wonderful third edition of National Stroke Conclave 2026. I really congratulate and ask you to put hands together to congratulate VOH for this third edition. Dr. Nishal, Pinky, and all the team who has made this effort, because the first edition happened, but that round of applause was not good. That is a good exercise. We should make it happen that the whole listen to it, right? So the first edition happened in Ahmedabad. We started from there, and then the second, and this the third. So on behalf of Indian Stroke Association as a secretary, you have listened to our president, what he has bound to make the address about what initiative we have took. So we always talked about in our executive committee and as Indian Stroke Association members that we talk among ourselves. We talk only among neurologists and do the conference and finish it. So then the picture came that we should move more further to get in this partnership, which is the theme of this conclave: innovation, partnership, and policy. And until and unless we do that, we bunch of neurologists, 5,400 and 1,400 members of Indian Stroke Association cannot do it. We have to expand. We have to get people like Stroke Support Group, as we are talking before the meeting, that we need people to support us, because stroke is not only acute treatment, it is a comprehensive treatment right from the acute care till the patient walks by himself. So it is not opening up the arteries. It is about the activity of the living, which a person can do, which we calculate after 3 months. So that is a comprehensive treatment in which neurorehabilitation also come, physiotherapists also come, OT also come, occupational therapists also come. So there are different stakeholders. That is why this conference, this conclave is important. Because we want every stakeholder to be at one place. As we are talking with Dr. Tameja, who is heading the brain health program in India, he was talking pre-conference. This is the platform, and this is how we develop a policy. What Indian Stroke Association is after, we are developing an accreditation process where we want to develop the SOPs for Advanced Stroke Center and the Primary Stroke Center. Where the barrier is, we are doing good in Advanced Stroke Centers because the cities are doing. What Dr. Tameja has said, that you should focus more on Primary Stroke Centers and you should develop as a brain health program. I thank you, Dr. Tameja, for telling about that initiative, and we'll definitely work in that part as Indian Stroke Association, because it is now time. We have no shame in accepting that we are 15 years behind the cardiologists. But we are not jadugars, because we have to work in a team, in a tandem, because we need a lot of people to work with us to develop that magic. So we have taken an oath to reach to the primary stroke centers and thrombolize. So it is the time, like the myocardial infarction, which Dr. Nishal was talking, to thrombolize in each nook and corner of India. That is what the Indian Stroke Association initiative is. That acute care and rehabilitation should reach every village and district where the CT scan is available. So be part of that initiative with us as Indian Stroke Association. We really thank VOH to do this program, and we're looking forward for a wonderful conclave. Jai Hind, Namaskar.
So much, sir. Thank you so much for sharing your perspective and enriching this session. And now, with the privilege of inviting a globally respected leader in stroke care, President of World Stroke Organization, Dr. Jairaj Pandyan. Sir couldn't make it due to some last work emergency, but we do have his message with us. Can we have the message?
Hello everyone, I am Dr. Jairaj Pandyan, President of World Stroke Organization. It's my pleasure to give this short address to the delegates and experts who have come from across the country for the Voice of Health National Stroke Summit. Unfortunately, I could not join due to the family reasons. Stroke is a major cause of death and disability in India. Recently, we had published data from Ludhiana villages, a verbal autopsy study, and stroke is the #1 cause of death. About 1 in 4 deaths in the Ludhiana villages were due to stroke. And there is a huge burden in our country and the fragmented healthcare system. Now, the other gaps are shortage of neurologists across the country. There are more neurologists in southern part of India as compared to North India, and particularly Northeast and Northwest, the number of neurologists are less. So in a situation like this, how we can improve stroke care in our country? The alternative option is stroke units run by physicians, and there are several models right from Punjab where we work with Punjab government, where we have started stroke units in all the district hospitals. Through AI software, we have connected with our hub, and the thrombectomy referral is ongoing now. And there are models like Himachal Pradesh, recently Maharashtra, we have Kerala, Tamil Nadu, and West Bengal. They have a great telemedicine model where the hub is the Bangalore Institute of Neurology in Kolkata, and they, using telemedicine, they connect with all the districts in West Bengal. And also, recently we completed the mobile stroke unit project in Tezpur and Dibrugarh. It was a success story, and based on the outcomes of the study, the 2 MSUs have been handed over to the Assam government by the Indian Council of Medical Research. So, even though we have several challenges, but there is a lot of progress, but we all need to work together. Our priority is establishing stroke units in all district hospitals, and also in at least 50% of the medical college hospitals in our country. Recently on March 24th, we released, along with the Ministry of Health and Family Welfare and PICI, World Stroke Organization, the National Stroke Action Plan, which was developed by the WHO Board of Directors from India, and also future leaders from India. And we need to take it forward with the Ministry of Health and Family Welfare. I'm already in discussion with the ministry, and we will work out some way how we can implement this National Stroke Action Plan with targets that have been set for 2030. So my sincere wishes to all of you, and all the deliberation discussion will really promote the stroke advocacy and improvement of stroke care in our country. Thank you very much.
We would like to convey our regards to Dr. Pandyan for bringing that important global perspective and helping us connect with the Indian context. We now move on to an important perspective from the industry side. As healthcare system evolve, the role of hospital network and leadership in building accessible and scalable care models become critical. So it is my pleasure to invite Group CEO of Yatharth Group of Hospital, Mr. Amit Singh, to please share his industry address with our audience.
respected dignitaries on dais, distinguished guest, respected clinician, esteemed colleague, delegates, very good morning to you all. It's my privilege to stand before you today at this National Stroke Conference, a gathering where we are going to discuss not only the scientific progresses, what we have made, but our collective and determinations to confront one of the most pressing health challenges of our time. Let me begin with some reality. When I was going through the figures, it was quite astonishing. India today carries one of the highest burden of stroke globally. Recent estimates suggest that over 1.25 million new stroke cases occurs every year, and it's contributing to nearly 10% of the global stroke burden. The prevalence has risen dramatically, with over 6.4 million people living with stroke in India, and cases increasing by more than even 130% over the past 3 decades. Even more concerning is the way the demographic shift in stroke. Now stroke is no longer a disease of the elderly. 1 in 7, and correct me if I'm wrong, there are so many eminent faculty there, but this is what I could get, I could gather the data. 1 in 7 stroke patients in India is below the age of 45, which is a very, very disturbing. And more than 50% of the patients, they can't reach to the, what you call critical treatment window period or a golden period, to the nearest the hospital where, this treatment can be given. So this is not just a healthcare issues, but it is an economic and a societal challenges for us. Because behind every statistics is a human story. A life get destroyed, a family get destroyed, a life altered in a seconds, a family reshaped, a future unexpectedly rewritten. So friends, from a healthcare delivery perspective, and we all know that, managing a stroke patient, it's a very complex, managing the complex atmosphere or ecosystem. Unlike many other conditions, outcome in strokes are profoundly time sensitive. Every minute of delay leads to an irreversible brain damage. So that require a very multidisciplinary or a very multi-departmental coordination, which is a very, very important. So largely, when I see what is the problem is is awareness. I think as previous speaker beautifully talked about the awareness, the identifying the early signs and symptoms, and then reaching out to the right place. That's the biggest challenge for us, particularly then when you go to the moving beyond the urban side of it, more towards the villages side of it, where the rural areas, whereas more than 60-70% of population is staying there. So that's the biggest challenge there. Second is about the access. So access is about access of the infrastructure, the technology, the clinical expertise. See, the various tools are there for early detection. It's not there. Right? So this access, and I will talk about that how this access problems can be even resolved with a small little actions which we take. So probably it will help. Third is very important about the integration. At that previous speaker said, stroke is not just an episodic, it's a continuum. From a prevention to the early detection to emergency response, then acute care, then long-term rehabilitation. This all required speak the same language. It requires a very cohesive, working. So as a hospital CEO, I see these are the challenges, but at the same time, I look at this is more the opportunity for us as well. So what are the opportunities? The A is we can build a very stroke-ready network. So every hospital may not be a very comprehensive stroke center, but every hospital must be part of the stroke network. So the hub and spoke model, where teleneurology can play a big role, where the gap between the urban and rural can be a bit bridged. Another thing is about stroke helpline. I think that's there. The government has a stroke helpline, but it's still, even from hospital perspective, as a private hospitals, if you can have some very some dedicated numbers, an emergency response number. So that helps a lot, where with the numbers, when somebody calls, you have your ecosystem within the hospitals, and then how that ecosystem moves and reach out to the needy and can save the life. Third, which is very, very important aspect, is about leveraging the technology and innovations. We all know that's how the AI and there are various tools who's playing a big role in early detections and saving the lives. It's making a big changes. And I'm sure all neurologists will adopt it. Last one, I would say, the rehabilitations. So usually in hospitals, rehabilitation has never been a part of the mainstream. But I think, rehabilitation it's very, very important because we see there is a big number of patients. We see the 40% of the patients which experience severely disability or death during the hospitalization. So rehabilitations must be integrated as in a mainstream of the stroke management program of every hospital, I would say. So colleagues, this is where the leadership matters. Hospital must go beyond the infrastructure. We must build the system. Clinicians must go beyond the treatment. They must lead the awareness. The policymaker must go beyond the intent. They must enable the execution. And as leader of the healthcare institution, we must ask ourselves, are we prepared not just to treat a stroke, but to transform the stroke care? Because the future will not be defined by individual excellence, but by a collective capability. In closing, I would like to say this: India has the clinical expertise, India has the technological capabilities, India has the skill to lead the world in stroke care innovation. What we need now is it's a proper alignment, the urgency and the commitment from our side. Let this conference today, what the conference is, we just not be a platform for a discussion, but be as a catalyst for a action. There will be some take-home message for all of us, and we need to act on that. Because every minute saved is a life preserved. So once again, thank you very much, and wish you all a very healthy and meaningful discussion on this event. Thank you. Thank you very much.
Thank you, sir, for sharing those valuable insights from a healthcare system perspective. We now move on to a very important address from the policy and national health system perspective. It is my honor to invite Professor of Neurology and Director, Institute of Human Behavior and Allied Sciences from New Delhi, Chair, National Task Force on Brain Health, Niti Aayog, Dr. Rajendra K. Dhamija, to deliver his special guest address.
Good morning to all of you, respected dignitaries on the dais and off the dais. It's really an honor and privilege to be here and talk about a subject which is very close to my heart for last more than 35 years when I started my MD. And one of my thesis of MD was to go in 51 villages of Haryana to find out the stroke cases and associated risk factors and the how we can bridge the gap. So that was 1988 and 89 when I published that data, and that is one of the most cited paper. And that started my journey in the stroke care, and then, of course, the history is there. We have heard a lot of issues and a lot of specific context in the terms of stroke in India. One of us sitting here, of course, is likely to have a stroke in the lifetime here in this country. Every minute, three of the country has a stroke. And that is not only, stroke is just not a physical disability, it cripples the mind and body alike. So people are left with disability, people lose their lives, people lose their livelihood, people lose their families, earning members. So this is very important to talk about stroke care, stroke prevention, stroke rehabilitation, and things like that. I just want to flag 3 or 4 main issues which have not been spoken. Of course, a lot of things have been spoken. One is the gender. So we talk about stroke in women or health issues in women mainly on the reproductive age group. That's adolescent and the maternal and reproductive age group up to 45. Hardly we speak about the issues after 45 in the women in our country. And we have seen the research has shown us that if we talk about even thrombolysis, this thrombolysis in stroke in women is much less than the men due to social reasons, due to family reasons, due to other reasons. So we need to focus on women after the reproductive age. So gender issue is very important. And we published, one of my colleagues, Dr. Devyaningar and me, published stroke in women in last 10 years in Neurology India, and we flagged various issues, what are the different risk factors, why the stroke in women is different from the stroke in men, and what can be done. And that one issue, particularly in Indian context, is very important to talk about in a conference like this, the National Stroke Conclave. And that is what I would urge the speakers and the organizers to talk about. Second is the aging. The aging is irreversible, aging is universal, aging is, it has to happen, you can't do about it. But if you see the numbers, as of now, 10% of people in India are living more than 60 years of age. And if you see 1.5 billion people in India, 1.45, the numbers are alarming. And these numbers are going to double in 2047 when we talk about Viksit Bharat. That means 20% of our population will be living beyond the age of 60 years. And these individuals will not be just the normal individual. They will have some lifestyle problems, some problems from aging, and many of them will have the stroke due to cardiovascular and cerebrovascular health issues. So we need to talk about the population at risk, that is aging, which is universal, and that the numbers are glaring, and that we need to talk about screening, we know about preventive brain health and preventive cerebrovascular health. And that is where the National Task Force on Brain Health is working now. And we have identified, we have started district brain health program in 12 of the districts in the country, 2 in the North India, 2 in the South India, 2 in the Eastern India, 2 in the Northeast, and of course 2 in the Western India. So these 12 districts are now having funded by the Niti Aayog 1 crore each for each district brain health center, where they are having now stroke ready centers also and talking about the preventive brain health. It's not just the stroke, but also stroke leads to vascular dementia, stroke leads to other problems. So obviously one has to be very, very cautious and very planning according to the consequences of the stroke. And that is where we are having this district brain health program. And I have been talking about district hospitals for the last 20 years, that district hospitals in 90s and early 90s and 80s were very good hospitals, but we have not been able to keep pace with the technology and with the advent of the tertiary care centers. The district hospitals have lagged behind in terms of infrastructure, in terms of educational facilities, facilities for doctors coming to district hospitals. So that is again an inequity in the country which we need to talk about. And district brain health centers are one of those examples in that. I also want to talk about neurorehabilitation. That is again very important, because in our country the focus is on acute and hyperacute care rather than continuum of care, and that I learned in my stay in Australia for 5 years, where I worked with Jeff Donnan, one of the strokeologists, that rehabilitation has to be equally important as is acute care. And we don't have much of rehab centers. This family-based rehabilitation or community-based rehabilitation are happening, but dedicated rehab centers are very far and few, and we need to invest on those. And I'm very happy to see the rehab and recovery hospitals coming up and focusing on rehab in the stroke care, and that is very, very important. Lastly, I think one of the other important things is the innovation and technology. Of course, the technology is here to stay and we cannot ignore it, and we need to use technology to our benefit for our stroke patients. And lately, the Indian Council of Medical Research has given us 5 crores to start what we call Promote India trial. So we have taken 5 centers, one in Delhi, which is my hospital, one in Rohtak, one in Himachal Pradesh, that is Tanda, one in Chennai, the Sri Ramchandran, and one in Trivandrum. So what we are doing is use of technology as a stroke riskometer. Stroke riskometer is the new AI technique where you can predict the stroke risk at the baseline, at 1 year, at 5 year, at 10 year. Then you can take corrective action according to your risk of having a stroke in the coming years. So stroke riskometer, like technologies we have to use in our practice, particularly for screening of large population. So we have identified 50,000 people. We will be screening them at the baseline and then after 6 months and 1 year. So that Promote India trial will give us validation of technology where we can use prevention of stroke, screening of stroke, and then of course the rehabilitation. So I think National Stroke Conclave like this is a major awareness campaign where we have not only campaigned about the stroke awareness in the population, but also in the policymakers, the clinicians, and anybody and everybody who deals with the stroke care in the community. So with these remarks, I congratulate the organizers and VOH, particularly Dr. Nishal, for organizing this. I have been part of the first National Stroke Conclave in Ahmedabad also, and I'm looking forward for many such events in the future so that we can create ecosystem in this country which is stroke friendly, and we can prevent strokes, we can prevent lives, and we can prevent, we have a good brain health. Thank you very much.
Thank you, sir. Thank you so much for highlighting the importance of policy alignment and national level initiatives in advancing brain health. We now move on to our keynote address, focusing on a topic that is very central to the future of stroke care: data-driven stroke care in India, building national registries, surveillance systems, and policy impact. And to deliver this keynote address, we are privileged to have with us the Director of ICMR, National Institute of NCD Epidemiology, Dr. Prashant Mathur. Thank you so much for joining, sir.
Good morning, everybody. Thank you, Voice of Healthcare, for inviting me and providing me the opportunity to attend this National Stroke Conclave. And also thank you, the previous speakers, to justify what I'm going to talk now. And I'm not a neurologist or a strokeologist, but through epidemiology, I can trigger you to think, and I can also monitor what actions you take. The topic which I was asked to speak is data-driven stroke care in India. And I have some brief presentations, so just to make my point across. These are the 5 strategic pillars of stroke care. I will not go through each one of them, but I would like to stick to my pillar, which is data and monitoring. So we run the National Stroke Registry Program for India. We started in 2018. Although this institute of ICMR, we got a new name just last month. We were earlier known as the National Center for Disease Informatics and Research, located in Bangalore. We are famous for the National Cancer Registry Program, which ICMR has been running for the last 44 years. And that is the only disease registry in this country for 44 years. And I do wish that the same scenario we can also achieve for stroke, where we have many, many more years of data monitoring. Our network comprises of 2 types of registries. One is a population-based stroke registries, which are run in 5 sites: Varanasi, Kota, Cuttack, Kachar, and Tirunelveli. And these collect data on stroke events occurring in a defined geography throughout the year. And based on the population, we are able to give you rates and burden of stroke. Then we have hospital-based stroke registries. We have currently 85 centers, hospitals, which are registered with us. And they include public, private, NGOs across the region. And since the theme of this conclave is partnership, if you are still not part of the stroke registry or hospitals, you are most welcome and invited to be part of this stroke registry program, because this is for you. This is not a research program of ICMR. Now, what do we present? We tell you that the crude incidence rate per 100,000 population varies from 82 to 192 in the population. So there is a wide range of stroke incidence. We also say that when you standardize this for the age structure of the population, the stroke burden goes from 101 to 251, and that the case fatality rate at day 28 ranges from 10.9 to 24%. This is based on our population-based stroke registries. Our mean age of occurrence of stroke is around 59 years, which is almost a decade before what the high-income countries experience. And that 14% of strokes are occurring in less than 45 years of age. And you rightly heard, 1 in 7 stroke patients occur below 45 years. There is a gender distribution, Dr. Dhamija. The women have worse 3 months outcomes compared to men, and predominantly it is male driven. And 3 in 5 patients are in their working age groups. We have published this paper as a multi-author paper in the International Journal of Stroke, 35,000 patients of stroke data. Currently, we hold data on around 1 lakh patients of stroke. What we add through this is that 72% of patients came from rural areas, 88% had first ever stroke, and 11% had recurrent stroke. Now, behind all these figures and statistics are stories, there are missed opportunities, and there are items for action. We looked at type of stroke, 60% ischemic stroke, 34% intracerebral stroke, and 1.7 undetermined stroke. Risk factors, hypertension, followed by smokeless tobacco use. This is mostly ignored risk factor in all our epidemiological studies. Diabetes, smoking tobacco, alcohol use, and anemia. Anemia was there in around 11% of patients, and this is moderate to severe anemia. Clinical presentations, mostly motor impairment, and then one can look at the profile. These are useful when we are creating advocacy material. So, you know how you arrange the order of symptoms. Start with headache first. Maybe it is a motor impairment to start those advocacy pamphlets. 20% arrived within 4.5 hours and only 5% arrived in 1 hour. Now, this is a missed opportunity. This is a call for action of pre-hospital stroke care. And the question is, should we only address through the Indian Stroke Association neurologists, 5,400 you said, or we should have physicians, everybody, as part of Indian Stroke Association? Why should it be limited to specialists, super specialists, DM people? Everybody, but you want partnerships from everybody, but you don't involve in your association. How will they be associated? Okay. The first responder to a person who has symptoms of stroke is a primary care physician, who is maybe just an MBBS fellow, who has no clue of classification of strokes and nothing. This person with good intentions is trying to do everything good for the patient. But are they doing it rightly, correctly, adequately, or are they overdoing it? Do we really need a CT scan at the primary level to be done? MRI to be done by the primary, and then pushing the patient for a thrombolysis? Is there a wastage of time? Or, because stroke traditionally is a clinical definition, you don't need imaging. So these are questions you should ponder upon, delayed referral. And here we are creating stroke-ready hospitals. What are you ready for? Isn't it? So this gap is something which we should look at, pre-hospital care, and a registry will be able to measure how are you performing, whether you are improving your referrals or not. And 37.8% came after 24 hours. Now we talk about creating awareness about stroke. Whom are we talking about? Patient? Why should a patient know about stroke? These are illiterate people. Normal citizens are health illiterate. They don't know. They have a problem. They know a problem. Maybe you need awareness in the physicians and doctors and many other alternative systems who handle patients, that when you say time is brain, they should also, this message should go down to the healthcare, so-called healthcare provider, formal or informal, that please don't waste time trying to figure out the type of stroke. Okay?
I don't know, some efficiency has to improve. Why should they arrive after 24 hours? Again, transportation is a big problem, so they don't know how to take this patient around. And then, as I heard, this stroke-ready ambulances to decipher which hospital is ready. All those are very good ideas. How do we implement it? And 4.6 received IV thrombolysis. Now, I am not presenting here reasons of such low thrombolysis, but when we look at the registry data, some of the reasons are very pathetic. It's not just drug availability, and I'm not presenting, but more registry data shows that most stroke patients report to hospitals when the system is sleeping between 3 a.m. to 7 a.m. When doctors are not there, the best doctors are not there, when the imaging fellows are away, when the system is at its lowest performance, patients report. We are not that fast. The same happens with acute MI also. So there are many, some not in a mood to do thrombolysis, it's okay. And then is there guideline concordance? Is there can't we give thrombolysis after 4.5 hours? Should we deny that? I don't know the answer. So, these are things which we need to ponder on. And 0.7% received mechanical thrombectomy. Now we are having large vessel stroke disease, 60% ischemic strokes. So where are the super specialists working? Where are they? Where is their performance? So, this is a multi-sectoral, multi-collaboration, even within the hospital. Okay, so when a call goes, everything should be ready to respond. Then we looked at functional outcomes, MRS scores. At discharge, 14% death. At 28 days, 24% death. At 3 months, 27% death. So most deaths happened within 28 days, 1/4 within the discharge period or the admission period. And when we look at this by the type of stroke, an undetermined stroke causes the highest disability. Now, all of this is a very large picture. I can speak for 1 hour if I unleash the whole registry data. But the point is not this. This conclave is about initiating action. And this is enough for us to think. And policy. Policy is something which we all talk about, we love to talk about, but we don't know the right way to connect with policy. And it has to be something which is actionable, which includes data capture, insight generation, decision support, policy formulation, and all. I've just listed out some number. Don't be fascinated by the numbers listed. These are just exemplars. Can we decide under the National Stroke Plan, which I heard, that the national thrombolysis rate should not be 5%, it should be 15%? Or is it aspirational? Is it too much? Can we reduce the onset to door time? At least 50% people should reach there. Severe disability, stroke admission unit, preventable deaths. Can NSDE, that I'm proposing, National Stroke Data Ecosystem, and we do a operating cost versus the routine National Health Mission to see whether we have such kind of a data informatics, and that helps us to respond much faster. So to have such targets, what will go behind, what will be the investments to do, is something which all of us need to get together and deliberate and discuss and come out with something. So I've drawn this stroke surveillance framework because this was also one of the subtopics. And if you look at, all are very logical. So we all work in our own silos. We all do very well in our own areas of work. The question is, can you, each one of you, reach out to the next fellow, to the next pillar? Can you connect with the next pillar? Can you realize that your work is relevant to somebody else also? And creating these data integration and analytic framework. So I'm hearing, we are running this trial, this multicentric study. All of you should connect commonly with the stroke registry. Stroke registry is not a research project. I never presented this as a trial of ICMR. This is a registry which grows organically as more and more data systems join it. Because it is impossible for a registry to collect the entire data set that is needed for it. Because if we have to address disease burden, equity, and better quality of life, we will need these collaborations and insights from everybody. We will need digital health systems. We do talk about in silos. But how are these digital systems enabled and connected to the main framework? Standardized definitions, cutoffs, data quality assurance, where accreditation plays a major role. Can we incentivize better stroke care? Capacity building, and capacity building is not amongst the super specialists, it is amongst the generalists and people outside the typical healthcare scenario. And most important, I would say, is governance and interoperability. So that, data systems should not remain in silos. There should be enhanced, because one data system cannot answer all the questions. And I'm sure you all must be having hundreds of questions in your mind. But one data system cannot capture all of them. And I would again urge to help strengthen the stroke registry, because this is your registry. Okay? This is a data without having, so time is brain, but brain is intelligence. You don't have an intelligent system monitoring your actions. And a registry is a possibility where in cancer we are doing it. So cancer control in India is heavily driven by the National Cancer Registry Program. So we have a model in place, we have a system in place, and we can replicate that very easily. Thank you very much for your kind attention.
Thank you, sir. Thank you so much for underlining the critical role of data in shaping policy and practice. With this, we have come to close of our inaugural session. We sincerely thank all our distinguished speakers for setting a strong tone for the day and for sharing the vision, insights, and direction on strengthening stroke care in India. We now move on to felicitation ceremony. I would request Dr. Nishchal, sir, to please felicitate our key dignitaries for the inaugural session. Dr. Arvind Sharma. I request a round of applause from our audience. Mr. Amit Singh. Dr. Rajendra K. Dhamija. Dr. Prashant Mathur. So can we have a group picture, please? Thank you, sir. Thank you so much.